Men who are experiencing symptoms of andropause or who have low serum testosterone levels often inquire about safe and effective methods of testosterone replacement. In addition to creams, patches, and injections, we have produced a brief training video for healthcare providers instructing them how to safely implant subcutaneous testosterone pellets.
This is your standard trocar kit. You'll see we have the trocar, the needled end, the blunt end to place the testosterone pellets or any form of hormone pellet you want to put in right here. We have an 11 blade scalpel, a syringe with a 1.5 inch 22 gauge needle for anesthetizing the area. And then we have the tweezers, which also can be applicators for the testosterone pellets into the trocar. Okay, we've already done our consent form, discussed the risks and benefits of pellet therapy, discussed the risks and benefits of hormone replacement therapy in general, reviewed drug allergies. We now have the patient draped in a sterile fashion. The area we're going to insert the pellets is cleaned with iodine after we've ruled out any iodine allergies. The area has been anesthetized with approximately 4 or 5 cc's of 1% lidocaine with epinephrine. We're doing a suprailiac placement of the pellets today. And basically, we'll just get started. Once you've numbed your area and determined the area you're going to numb up, be able to grab it with your hands through the sterile field. I'm in a sterile gloves right now. Through the sterile field, you can see our entrance point for the numbing. The numbing solution was fanned out through this area that we're going to put the pellets in. It's a good idea to grasp it like this and picture in your mind where you're going to lay the pellets in the subcutaneous fat. It makes it a lot easier and a lot quicker for the procedure to be done. Once you have your area found, I use the same track mark that I anesthetized the area with. You got an 11 blade here. I'm going to grab my skin here, make a little tiny incision, make sure the patient doesn't feel that. Do you feel that, sir? Now that we know he doesn't, just a little incision into the subcutaneous fat, and that's it. You can see I'm into the fat material. That's all it takes. From there, I'll take the trocar kit, and again, just to review, my trocar kit, that's where I place the testosterone implants, and this is the needled end. I hold it just like I do a syringe. I grab the patient's skin again, and again in my head I've pictured where I'm going to place those implants, and I'm going to place them right in a fan-like projection right there. So going through my incision, again in a perpendicular or parallel fashion to the patient's fascial plane, I go straight in. Make sure he didn't feel that. No pain, sir? No. Remember, fat is a connective tissue, so it's going to be a little tough to get through, and you'll hear some cracking, snapping, and popping, but again, that's the connective tissue portion. Once I'm in there, I visualize how far my trocar is in. I know where my first implant's going to go, so I'm going to take out the needled end. Again, I keep my hand here the whole time. Taking my testosterone pellet, I place it directly into the trocar. Using the blunt end of the trocar, the same way again with the needle application, I insert, I pull back a little, I switch back to the needled portion, I go right next, slightly down as you can see, reposition my trocar right next to my original implant. Plant another pellet. Again, push it in, pull it out a little, reposition with the needle trocar right next to it. And as you can see, this is a very easy and quick procedure to perform once you're comfortable with doing it. Now, once I'm done with the implants, I simply pull the whole trocar mechanism out, put some steri strips directly over our wound, give the patient wound care instructions, signs and symptoms of infections, and when to follow up with me next week to see how he's doing, and we're done.